Picture this. You were sitting in your living room and you're watching a Pomeranian for, say, 30 seconds.
Honestly, 30 seconds is really all it takes.
Right. In that half minute, you are treated to just a complete theatrical performance. You've got this massive, glamorous double coat, bouncing with every single step.
Oh, absolutely. The bounce is iconic.
Yeah, and the tail is curled tightly over the back like a little plume. There's this sharp, sudden bark at a sound only they can hear, and then boom, a full high-speed sprint across the rug. I mean, it is the absolute ultimate picture of vitality.
It really is pure kinetic energy. That vibrancy is, well, it's a huge part of the breed's charm. When you watch them in motion, it feels like this animal operates on just a limitless battery of drama and stamina.
Totally. But the mission for our deep dive today is to take that vibrant high-speed footage and slow it way, way down. We want to look right past that performance. So, okay, let's unpack this, because underneath all that glamour and motion, there are incredibly subtle health signals playing out in real time.
Very subtle.
Things you will completely miss if you are only focused on the show. We're talking about, like, a microscopic hitch in a back leg, or a specific kind of breathing pattern after a sprint, or even just a slight change in how they chew their dinner.
And the crucial context here, really the lens through which we need to view all the sources we're examining today, is that noticing these physiological quirks does not mean a disaster is striking.
Right, that's so important.
Yeah, breed awareness is preparation. It's not fate. The goal today isn't to make you panic every time your dog twitches in their sleep.
No, definitely not.
We want to build your diagnostic eye. We're looking at the biological mechanics behind these small signs, so you know precisely what requires a veterinary intervention and what is, simply a structural reality of the dog.
So to understand those structural realities, we really have to start at the front. Literally, their tiny little faces and the anatomical consequences of extreme miniaturization.
It's a big deal.
It is.
Yeah.
You shrink a wolf down to a 5-pound companion animal, and the biology gets very complicated, especially inside the mouth.
The oral cavity is arguably the single most important and simultaneously the most underappreciated battleground for toy breed health.
I was actually reading through the veterinary dental notes in our sources, and it brought this very specific image to mind. Think of a Pomeranian's jaw like a tiny 300-square-foot studio apartment.
Okay, I love that comparison.
Right. Now imagine taking all the furniture from a standard 3-bedroom house, which in this case is 42 adult canine teeth, and just trying to cram it into that tiny studio.
It's a logistical nightmare.
Exactly. The teeth themselves didn't shrink proportionately with the dog's skull. So you have teeth that are rotated sideways, impacted against each other, and essentially just stacked up.
And that structural crowding creates a mechanical nightmare for dental hygiene. Because the teeth are jammed together at abnormal angles, they create these deep, completely inaccessible pockets.
Where everything gets stuck.
Exactly. Food debris gets trapped in those crevices instantly. And that debris feeds anaerobic bacteria, which forms plaque, which then rapidly mineralizes into tartar. Yeah, and in a toy breed, that process happens at a highly accelerated rate compared to, say, a larger dog with proper spacing between their teeth.
I hear this all the time from small dog owners, though. They say, well, his breath is terrible, but, that's just small dog breath.
What's fascinating here is how entirely we have normalized a symptom of active disease.
Wait, really? So it's not just a breed trait?
No, bad breath is not a breed trait. Halitosis in these dogs is literally the smell of bacteria proliferating and tissue actively decaying.
Oh, wow. That is incredibly grim.
It is. It's a flashing warning sign of periodontal disease, where the immune system is fighting the bacteria, leading to gingival recession, receding gums, and eventually the loss of the jawbone itself.
So beyond the breath, the sources point out some really interesting behavioral tells. If a listener's dog is suddenly dropping kibble on the floor, or chewing exclusively on one side of their mouth, or maybe suddenly turning up their nose at a favorite hard chew, we often assume they're just being fussy.
Right, the picky eater myth.
Yeah. But in reality, they're actively managing oral pain.
They are avoiding mechanical pressure on a loose or infected tooth. And while brushing at home is a fantastic preventative measure, if you start it in puppyhood, of course, brushing cannot remove mineralized tartar or clean below the gum line.
That makes sense.
Yeah, that requires professional veterinary scaling. The objective isn't a cosmetic Hollywood smile. The objective is stopping chronic pain that the dog has simply learned to live with silently.
And that oral bacteria doesn't just stay in the mouth, which we will actually get to in a moment when we talk about the heart.
Yes, that connection is crucial.
But moving from the back of the throat down into the chest, we run into another massive structural challenge of miniaturization, the airway. Specifically, a condition known as tracheal collapse.
This is a highly prevalent issue in Pomeranians and other toy breeds. To understand it, you really have to look at the anatomy of the windpipe. So the trachea is held open by these rings of cartilage. In a healthy, larger dog, those rings are stiff and shaped like a letter C. But in many miniaturized breeds, the cellular matrix of that cartilage is genetically weaker.
So it just doesn't hold up.
Right. Over time, the cartilage softens and flattens out. That C shape slowly turns into a U shape.
And when they inhale deeply or get super excited, the negative pressure in the airway literally sucks that weakened tube closed.
Yes, exactly.
And that is what causes that very distinct, dry, honking cough. I mean, it literally sounds like a goose honking.
Exactly the sound. When the dog gets excited or overheated or, and this is a big one, pulls on a leash, they need more oxygen.
Right.
So they pant harder, the air velocity increases, the pressure drops, and that weakened trachea just snaps shut momentarily. It's incredibly distressing for the dog.
Which is exactly why the sources are so militant about using harnesses instead of neck collars for walking.
Oh, absolutely mandatory.
Because if you attach a leash to a neck collar on a Pomeranian and they pull to sniff a bush, you are applying direct, crushing mechanical force right onto those fragile cartilage rings.
You are actively accelerating the collapse. A well-fitted harness distributes that pulling force across the chest and shoulders, entirely bypassing the throat.
That's such an easy fix, though.
It is. You can keep a collar on them for ID tags, but a leash should never, ever be clipped to it.
So if the little honking cough happens during a wild burst of excitement, when does the listener need to escalate this? At what point do we go from, managing a structural quirk to an emergency vet visit?
You are really monitoring their recovery time and oxygen perfusion. If they cough a few times, calm down, and breathe normally, you just make a note of it.
Okay.
But if the coughing is persistent or you see their sides heavily heaving as they struggle to pull air in, that's an escalation. The clearest visual red flag is checking their gums.
Like the color of them.
Yes. Healthy gums are bubblegum pink. If those gums look pale, gray, or take on a bluish tint, which is a condition called cyanosis, that means oxygen is no longer reaching their tissues. That is an immediate emergency.
Wow. And oxygen restriction directly impacts their stamina, which transitions us perfectly into the physical framework of the dog. We have a tiny airway working overtime to supply oxygen to the muscles, and now we have to look at the structural integrity of the joints doing all that running.
Yes, the joints are under constant stress.
The research highlights a huge vulnerability in their knees, specifically a condition called luxating patella.
Right, so the kneecap, or patella, is supposed to sit snugly inside a vertical groove at the bottom of the femur bone. When the dog bends and straightens its back leg, that kneecap should just glide smoothly up and down within that track.
But in Pomeranians, the anatomical design is often totally flawed.
Often profoundly flawed. Due to the way their tiny legs are angled and because that femoral groove is frequently much too shallow, the mechanism just fails. Yeah. When the dog runs or pivots, the pull of the thigh muscle simply yanks the kneecap completely out of the groove and onto the side of the knee.
And this manifests in real life as the classic three-legged hop, right? The dog is sprinting across the yard, suddenly pulls one back leg up, skips a few times on three legs, and then suddenly puts the foot down and keeps running like nothing happened.
Yep, they just pop it right back in.
They do. And because they don't always cry out in pain when it happens, owners tend to brush it off as a cute little quirk.
They do, but every time that bone slides out of its shallow track, it grinds against the cartilage.
Which can't be good long term.
It's terrible. Over months and years, that friction destroys the cartilage, leading to severe, irreversible osteoarthritis. It also puts immense strain on the cruciate ligaments, making a full tear much more likely.
So what does this all mean for the owner? The veterinary advice always seems to be prevent jumping and excessive strain. But let's be real. Telling an owner to never let their Pomeranian jump on the sofa is virtually impossible.
Oh, completely unrealistic.
Right. They are fast, they're determined, and they basically have springs in their feet. If complete environmental management fails, or is just unrealistic for a normal household, what is the actual risk here? Are we just trying to prevent a momentary hop?
No, the risk is chronic, lifelong pain, and early immobility. Look, you cannot stop a dog from being a dog, but you can alter the physics of their environment.
How so?
You mitigate the repetitive sheer force, you put soft steps or ramps against their favorite sofa so they have an alternative to launching themselves vertically. You throw rugs down on slick hardwood floors.
Or traction is a big one.
Huge. When a dog jumps off a couch onto a slippery floor, their legs splay outward upon landing, which puts catastrophic lateral torque on a knee that is already prone to dislocating. Traction is just as critical as preventing the jump itself.
But there is one factor that takes both the tracheal collapse and the luxating patella and just turns them into critical failures. It is the ultimate aggravator of toy breed health.
Weight.
Weight. Every single source we have points to obesity as the primary enemy.
Weight is the great multiplier. Think about the chalet groove in that knee. If you add 2 pounds of excess fat to a 6-pound dog, you are increasing the downward shear force on that unstable joint by over 30%.
That's a massive increase.
It is. Furthermore, excess fat deposits inside the chest cavity physically restrict the lungs from expanding fully, making the tracheal collapse significantly more dangerous. Extra weight chips away at every single bodily system simultaneously.
Which brings us to the most insidious thing about this breed. If weight is the enemy, why is it so incredibly hard to manage in Pomeranians?
Oh.
Because their defining physical feature, the double coat, acts as a master illusionist.
It really does. It completely obfuscates their physical reality.
Think of it like this. The Pomeranian coat isn't just a thick winter parka. It's basically a sensory deprivation tank for the owner's eyes.
That's a great way to put it.
You could have a dog that is dangerously underweight, or a dog carrying 3 extra pounds of joint-crushing fat. And standing across the room, they look exactly the same. They just look like a fluffy cloud. You cannot use your eyes to evaluate a Pomeranian's body condition.
Which is why relying strictly on a hands-on body condition score is mandatory. You have to get your fingers past that dense undercoat and physically palpate the ribcage.
What should that feel like?
When you gently run your hands over their sides, the ribs should feel like the back of your hand right behind your knuckles, distinct, but with a slight padding. If it feels like the palm of your hand, the dog is overweight. If it feels like a clenched fist, they are too thin. And honestly, stepping them onto a digital scale every month is the only empirical way to track it.
Here's where it gets really interesting to me. The coat isn't just hiding their waistline. It acts as a camouflage for dermatological conditions. And reading through the sources, the line between a grooming problem and a medical problem gets extremely blurry for a lot of owners.
It is a very common trap. And owners might notice the dog is scratching obsessively, or they find dry, flaking skin, thinning fur, or smell a musty odor.
And they just buy new shampoo.
Exactly. The immediate consumer instinct is to assume the dog has dry skin, so they buy an oatmeal shampoo or change their brushing routine.
But those signs aren't telling you to become a better groomer. In a Pomeranian, they are almost always symptoms of systemic pathology occurring beneath the skin barrier.
Precisely. Pomeranians are highly susceptible to atopic dermatitis, environmental allergies that manifest as itchy, inflamed skin. They are also prone to endocrine disorders like hypothyroidism, which slows the metabolism, alters sebum production, and causes the coat to become brittle and fall out.
But what about that musty smell?
That musty odor isn't dirt. It's often a secondary yeast infection blooming on compromised skin.
So the rule of thumb here is really clear. A groomer's job is to maintain the dead hair on the outside. A veterinarian's job is to investigate the living organ, the skin on the inside.
Perfectly said.
If the texture of the coat changes or the dog is losing hair, you need a blood panel and a skin scrape, not a different conditioner.
That is the exact distinction. And while the coat can hide these chronic, slow-moving issues for months, giving you time to figure it out, there are other biological vulnerabilities in this breed that do not afford you the luxury of time.
The acute stuff.
Yes. These are the rapid onset emergencies.
Let's start with their eyes. Because of their skull shape, Pomeranians have somewhat prominent eyes and relatively shallow eye sockets. Combine that with the fact that they are 6 inches off the floor, plowing through tall grass, dust, and under furniture, and they are basically walking hazard zones for ocular trauma.
They are at a significantly elevated risk for corneal ulcers. Because more of the eye surface is exposed, the tear film evaporates faster, causing dry spots.
And then what happens?
It takes almost nothing. A stray blade of grass, a speck of sharp dust, or a clumsy scratch from their own paw to tear the outer layer of the cornea.
The sources are incredibly strict about how to handle this. If a listener sees their dog actively squinting, which is apparently called blepharospasm,
Hmm?
or if the eye is heavily tearing or visibly cloudy, that is not a wait-and-see situation.
Never. The eye can deteriorate from a microabrasion to a deep, infected, and potentially rupturing ulcer in a matter of 24 to 48 hours.
That fast.
Yes. If the eye looks wrong, you bypass the internet research and you go straight to a veterinarian. Ocular pain is excruciating, and time is tissue.
Speaking of time, we have to talk about how time affects the Pomeranian heart. Earlier, we discussed the mouth and how that tiny, crowded jaw becomes a breeding ground for bacteria.
Right.
One of the most fascinating physiological connections in the research is how that oral bacteria travels through the bloodstream and directly assaults the heart valves.
We are talking specifically about myxomatous mitral valve disease, or MMVD, which is incredibly prevalent in senior toy breeds.
And this is caused by the teeth.
It's heavily linked. The bacteria from the mouth constantly enters the bloodstream, passing through the heart. Over time, this contributes to the thickening and scarring of the mitral valve. The valve stops sealing properly.
Which means when the heart pumps, instead of all the blood going forward into the body, some of it squirts backward into the atrium. That backward turbulence is what a vet hears as a heart murmur.
Yes. And as the leak worsens over the years, the heart has to work harder and harder, eventually leading to congestive heart failure. The insidious part is that early-stage heart disease is entirely invisible to the owner. The dog acts perfectly normal.
So how do we catch it before they are in failure? The research suggests a brilliant, entirely free at-home diagnostic tool, resting respiratory rate.
It is the single best metric an owner can track. When your dog is completely asleep, not dreaming, just in a deep sleep,
Yeah.
you count how many times their chest rises and falls in 1 minute.
What's the target number?
A normal rate is usually under 30 breaths per minute. If you consistently track this and suddenly notice it's creeping up to 35, 40, or 45 breaths per minute while sleeping, that means fluid is beginning to build up in the lungs due to the failing heart.
So it's an early warning system.
Exactly. You catch that shift early, the vet starts medication, and you can buy that dog years of comfortable life.
So we have senior dogs facing valve degeneration. But before they even get to that age, they face a massive, immediate existential threat at the very beginning of their lives. Toy breed puppies.
Profoundly fragile biological systems.
I was trying to conceptualize why a tiny puppy is so much more vulnerable than a larger breed puppy. Think of a 2-pound Pomeranian puppy, like a high-revving exotic sports car engine, but it's equipped with the fuel tank of a lawnmower.
That's a great visual.
The engine is burning energy at an astronomical rate just to keep their body temperature up and their organs functioning. But their fuel tank, which in this case is their tiny liver, is physically too small to store enough reserve fuel.
And that fuel is glycogen. In a larger dog, the liver stores plenty of glycogen to maintain blood sugar levels between meals. But a toy breed puppy has virtually no reserves.
None at all.
Very little. If they miss a single meal, get overly chilled, or experience a spike in stress like, moving to a new home, they burn through their meager glycogen storage in a matter of hours.
And when the liver is empty, the blood sugar plummets, resulting in hypoglycemia. Without glucose, the brain literally begins to starve.
The clinical signs are terrifyingly fast. You will see sudden, severe trembling. They become lethargic or exhibit ataxia, meaning they walk like they're drunk and uncoordinated. If not reversed immediately, it progresses to seizures, coma, and death.
This is why breeders send these puppies home with tubes of Caro syrup or nutritional gel. If you see a toy breed puppy acting wobbly or lethargic, you rub sugar syrup directly onto their gums so it absorbs instantly into the bloodstream, and you immediately head to an emergency clinic.
You absolutely do not wait.
Right, you do not put them in a crate to see if they feel better in the morning. They will not survive the night.
It is an acute medical crisis, plain and simple.
We've covered so much physiological ground, from the structural collapse of the airway and the physics of the knee joint, to the bacteria invading the heart and the high-speed metabolism of a puppy. But the final health signal in our deep dive is perhaps the most complex because it relies on the dog's mind. We are talking about behavior as a diagnostic tool.
Yes. If we connect this to the bigger picture, dogs do not possess a verbal language to articulate chronic low-grade pain.
Obviously.
They cannot tell you that the arthritis in their luxating patella is flaring up due to the rain, or that a fractured tooth is throbbing, so they communicate their physical reality through behavioral shifts.
And this is where owners make a massive analytical error. We anthropomorphize them, we see a behavioral shift, and we attribute human emotions to it. We say, oh, he's just being spiteful today, or she's just getting grumpy because she's older. Pain is constantly masquerading as personality.
It is one of the most tragic misunderstandings in veterinary medicine. A dog that suddenly starts growling when you go to pick them up isn't developing a bad attitude. They are guarding a painful spine or abdomen.
Wow. Yeah.
A dog that suddenly hides under the bed or refuses to be brushed is experiencing discomfort.
One of the most frustrating examples in the sources is house training regression. A 5-year-old Pomeranian, perfectly trained to go outside, suddenly starts peeing on the living room rug. The owner's instinct is anger. He knows better. He's doing this to punish me for working late.
Right, when the biological reality is that the dog likely has a raging urinary tract infection or bladder stones, and they physically could not hold it.
Or what about the joints?
Yes, going back to the knees.
Ugh.
Maybe walking down the porch steps to the yard has become too painful due to joint degradation, so the rug is simply the least painful option. Before you assume a sudden change is a training issue, you must scientifically rule out a medical issue.
Which actually beautifully tees up exactly where we are going in our next deep dive. Next time, we are diving straight into the Pomeranian's mind. We're going to unpack the psychology of their barking, their outsized confidence, and map out exactly how to decipher the difference between a dog that needs behavior modification and a dog that is desperately trying to communicate physiological discomfort.
It will be a vital continuation of the biological foundation we've built today.
So let's synthesize the journey we've been on. We started by looking inside the crowded 300-square-foot studio apartment of their mouth, tracing how oral bacteria cascades down into heart valve disease. We examined the structural reality of the weakened tracheal rings and the shallow knee grooves, learning how to mitigate shear force with harnesses and ramps.
We ripped the camouflage off the double coat.
Exactly, to expose the truth about weight as the ultimate health multiplier, and we explored the urgent, acute dangers of corneal ulcers and puppy hypoglycemia. The overarching theme for you, the listener, is this. Your job as the caretaker is to establish the baseline and meticulously observe the deviations. It is your veterinarian's job to diagnose what those deviations mean.
This raises an important question, and it's something I want you to mull over as we wrap up today. Consider how much of what we casually categorize as personality or temperament in our animals, and honestly, perhaps even in ourselves and the humans we interact with daily, might actually be an unexpressed chronic physical state.
That's a huge thought.
How much of what we label as stubbornness or irritability is simply an underlying physiological discomfort that we just haven't learned the language to interpret yet?
So next time you are sitting in your living room, and you see that Pomeranian in full motion, the bouncing coat, the curled tail, that picture of perfect kinetic vitality, absolutely enjoy the performance. But remember, you now possess the analytical tools to look past the show, to slow the footage down, and to truly understand and protect the magnificent, complex little biological engine running underneath.